This is a very young patient with severe aggressive periodontitis, lower anterior teeth missing. They became mobile and fell off. This premolar is also mobile, so we are going to replace those anterior and premolar. The bone quality is somewhat okay, except in the premolar there is severe crystal bone loss. We'll see the immediate post-op. We did this patient in 2021. So, 2 BCS implant. The tip is hitting the lingual cortical bone. This is intraoperative. We'll see the X-ray taken later, after a few months. You can see those 2 BCS implants, they are well integrated. Though it looks they are very smaller in length, this is more than enough because they are in good bone. There is no need to select a longer implant which goes till the lower part of the mandible. This is the implant which we placed post extraction in premolar. It's a compressive implant, probably 3.75 or 3.5 into 18 or 16. It is well integrated. The bone, crystal bone is good. No bone loss, nothing. We can see the healing in this view, the axial section view. If we see here, these 2 basal implants, they are close to the lingual plate. They are close to the lingual plate. Trying to selecting a longer implant will lead to perforation on the lingual aspect. Yeah. So we will see the healing in 2023, so 22, almost more than 2 years. So we will see the buccolingual cross section. The BCS implant is well integrated. This is a rough surface implant. This is also well functioning now.